Behavior analysis in pediatrics. This is the agenda for this presentation. I want everyone to understand the field of pediatrics in detail, like the different levels in which they are operating and what are the medical conditions they are dealing with, and also the need for ABA services in that area and the evidence-based proof for our efficiency to deal with those conditions. I have explained like why we have to get into the field of pediatrics and how we can get into the field of pediatrics and what we can do in the field of pediatrics, and in the last I have explained few of the domains that we can be actively participate in the field of pediatrics. Objectives. So once you are done with the presentation, you have to identify the basic concepts of pediatrics versus behavioral pediatrics and identify the need for behavior analysis in the field of pediatrics. And you have to identify the goal of ABA in primary care and ABA in the developmental and behavioral pediatrics, and you can identify the different domains a behavior analyst could to work on pediatrics. These are the 5th edition task lists we can easily explain once we are watching this presentation. So for the next few slides, we are going to dive deep into the field of pediatrics. Pediatrics. So what is pediatrics? Pediatrics is a branch of medicine dealing with the health and medical care of infants, children and adolescents. The word pediatrics means the healer of the children. So the aims of the pediatrics is to reduce the infant and child rate of deaths, control the spread of infectious diseases, promote healthy lifestyle for a long disease-free life, and help ease the problems of children and adolescents with chronic conditions. So pediatricians usually diagnose and treat several conditions which include injuries, infections, genetic and congenital conditions, cancers and other dysfunctions. About the immediate management, but they are also dealing with the long-term effects on quality of life of the disability and survival. Like they will deal with the problems which include developmental delays, disorders and behavior problems, functional disabilities, social stresses and the mental disorders as well. So, pediatrics operates on two levels, the primary care, early intervention, and the developmental and the behavioral pediatrics. From the PIM and the readings, we are very familiar with the word the primary care. So, hopefully, everyone should have an idea like what is primary care. Now, I am going to explain what exactly is the primary care and what is developmental and behavioral and what are the medical conditions they are dealing with and what are the differences between the primary care and the developmental behavioral pediatrics. Now, the early intervention and the primary care. The American Academy of Pediatrics Council on Children and with Disabilities provides the guidance from the primary pediatric healthcare professionals through the policy statement, role of the medical home in family-centered early intervention services. Like these early intervention services are family-centered and they are collaborating with the families and they are dealing with the at-risk children population to have their appropriate and developmental EA services, that they are ensuring that the children are receiving the appropriate clinical and the developmental EA services. The government is giving much importance to this primary care, like the early intervention services. So you can see so many like under idea a family must be offered at no loss to the family a development eligibility assessment within 45 days. Like if the child is determined to be eligible for EA services, the intervention services may be offered at no cost to the family, like billed to the family's medical insurance or supported by the family co-pays as determined by each state. So this statement illustrate the importance given by the government to the early intervention primary care. We are going to see like why this much of importance is given to this primary care later in the slides. So, what is early intervention? Early intervention programs try to improve the developmental outcomes of the children who exhibit or are at high risk for the developmental delays. And how they are doing this is like they are doing this by teaching the parents about the infant development and how to enhance developmental stimulation, helping parents understand their infants' behavioral cues, acknowledging and addressing the sources of parental stress, and providing developmental therapies. For example, the physical therapy and occupational therapy, so far they have embedded into this system. So, like other than the medical conditions, the pediatricians in the primary care, they have to deal with the developmental delay problems, the behavioral problems associated with the developmental delay problems in the areas of cognitive, physical, communication, social or emotional and adaptive. So this is the area what they are dealing with. Now we are going to see the next level of pediatrics, that is developmental and behavioral pediatrics. So who is a developmental pediatrician? So the developmental pediatricians, sometimes called as developmental disabilities and behavioral pediatricians, are medical doctors who have completed a residency in pediatrics and have additional subspecialty training in developmental and behavioral pediatrics. So when we are doing some Google and when we are seeing something like behavioral pediatrics, so 90% of the chances it's not the behavior analyst in the field of pediatrics. It's these medical doctors who have 3 years of 3 years of studies and residencies under the subspecialty of developmental and behavioral pediatrics. So they are performing a wide range of services like the outpatient development. They are giving the behavioral pediatric clinic. They are having the pediatric feeding team. So if we focus more attention into the team of the team, like the feeding team, we can see developmental behavioral pediatrics, psychologist, dietitian and occupational therapist. So they have included the other fields of psychology and occupational therapy but not the ABA, because they are not aware of what ABA is actually. So these developmental and behavioral pediatricians, they evaluate and provide treatment and referrals for children with a wide range of developmental and behavioral concern, which includes like the learning disorders, the ADHD, the ASD, the other syndromes like tics, Tourette and the other habit disorders. And they are the one who deals with the sleep disorders, feeding problems, discipline difficulties and other the difficulty in toilet training issues, and the development disabilities, which includes the ASD, visual and hearing impairments, delayed development in speech, language, motor skills and thinking, and all the behavioral and developmental problems complicating the full range of chronic illness. Behavioral pediatrics. It's apt to say behavior analysis in the pediatrics. So behavioral pediatrics is the application of behavior analysis to the behavior problems that present in the pediatric medical settings. We are going to see how to get behavior analysis into pediatrics and why we have to work in that field and what we can do in the field. So usually if we are going to know how and why, it's like we are going to understand the concept very clearly. So in the next few slides we are going to deal with the how, why and what behavior analysis in the field of pediatrics. The first point is like how we can get into the field of pediatrics. So whenever we are going to get into a new field, it's an important thing to understand, know the organisms and the environment. Like it's important to know something about the pediatricians, including the ways in which they are trained and the contingencies under which they operate. And the training, like we have to understand the biomedical model followed by the pediatricians. That's why I have explained the field of pediatrics in that much detail in my previous slides. Now the contingencies. Now we are going to see like what we can do in the field of pediatrics in these contingencies and why we have to do this. So like when considering the contingencies, as behavior analysts we have access to the powerful behavioral technology that can fix common health behavior problems in a short amount of time. So by establishing a collaborating relationship with a BA, the pediatricians can make a valuable colleagues, and like usually all the pediatricians will have a doctor family relationship, because like they are going to deal with the cases right from the birth till they are going to be 18. So collaborating with the pediatricians to assist them in providing them better management of child health problem behaviors should serve to enhance this doctor family relationship as well. Now we are in the part why. Why we have to pay attention to the field of pediatrics. So we all saw the PIM and we all have the readings from the Freeman 2010. So Freeman observed that despite ABA's success with special population, the discipline had failed to achieve the mainstream relevance. He argued that integrating into settings and institutions that have established contact with the mainstream provided a path for the expansion of ABA into reach a broader population. Subsequently, he proposed an ideal opportunity exists for ABA to achieve more widespread influence in the context of pediatric primary care. Like he even illustrated his vision of discussing how a common childhood problem, diurnal enuresis, can be effectively treated in the primary pediatric care using the ABA method and the principles. So it's like it's our duty, like it's the duty of every behavioral analyst to disseminate ABA. So to disseminate the science of ABA into the mainstream is one of the thing we have to think about while in our practice. Now we are going to see why behavioral pediatrics in the primary care. So, in Freeman 2010, the author clearly explained the limited time of consultation and why the pediatricians are not able to deal with the behavioral issues. Like they don't have the learning history, like how to deal with the behavioral issues in the for the pediatricians in the primary care. And also, like as healthcare becomes more costly and third party payers demand outcome based standards for care, there has been a renewed call for evidence based behavioral health treatments that can be delivered in the medical settings, specifically within the primary care. So all these articles shows like what is the importance of the behavioral analysis in the primary care and how integrated primary programs can be used widely all through. Like integrated primary care is a treatment model that embeds the behavioral health specialist within the primary care settings. So this is the reason like there is a need for a behavior analyst in the field of primary care, so we can do something in the field and we can also address most of the clinical conditions that they are having in the primary care. Now, behavior analysis in developmental and behavioral pediatrics. If we are going to do a simple math, we can understand that it would require nearly 80,000 board certified developmental behavioral pediatricians to provide the same level of subspecialty care for approximately 25% of the pediatric population with developmental behavioral concerns. So it's clear that there is a scarcity of developmental and behavioral pediatricians. So this combination of a very high prevalence of developmental and behavioral disorders and an enormously critical shortage of subspecialists to whom patients may be referred creates an extremely long waiting list at tertiary care developmental behavioral evaluation centers. So this makes the subspecialty referral a futile proposition for the vast majority of the children with developmental and behavioral concern. Thus, most children with developmental or behavioral concern must be managed within the primary care medical homes. So they are trying to push everything into the primary care, and that is the reason why we usually talk about the primary care. But from the behavior analysis, we can deal with all the conditions, all the behavioral issues what they are dealing with, both the primary care and the developmental behavioral pediatrics. There is a lot of need for behavioral analysts in the developmental and behavioral pediatrics. So far in the presentation we understood that why we have to get into the field of pediatrics and how we can get into the field of pediatrics. Like it is a need for there is a need in the field of pediatrics for a behavior analysis, and as a behavior analyst we are having a need to disseminate our science into the mainstream. So like as Freeman in 2010 he told like the successfully integrating in with the primary care would require no new conceptual tools or no new scientific discoveries. It could be accomplished with 2 or 3 principles of behavior and a handful of applications which we are having already. So now we are coming into the part like what we can do in the field of behavior analysis and uh, like the evidence-based literatures to support our efficiency in those areas. So we can divide the field of pediatrics into 4 domains with which they are dealing with their problems, which in the 4 domains are like the routine behavior problems, the behavior problems with significant medical dimensions, and the medical problems with the significant behavioral dimensions, and the non-compliance with the medical regimens. So ABA can deal with all these 4 domains efficiently, and there is a lot of evidence-based literatures, researchers based on these domains. I took one example according from each concern. So for the first concern, I have taken like the aggression. So as we all know, ABA can do a lot with aggressive behavior. So with the ABA approach, we are having our own assessment and the measurement using the FBA and the function analysis. We can easily find the function of the aggression, and then using the reinforcement strategies, antecedent strategies, and the functional communication training, we can effectively treat the aggressive behaviors. And we have evidence-based literature dealing with treatment of aggression and violence, that is attention main, escape motivated, and automatically reinforced. I have quoted few of the articles. If you want, you can go through these articles and you will find a lot of references from these articles that is going to help us to manage the aggressive behavior. And some of we have even studies suggesting that concurrent operant analysis may be useful when therapists cannot consistently refrain from responding contingent from on problem behavior in the control condition of a more typical functional analysis. So we are having enough evidence-based literatures to prove our efficiency to treat the aggressive behavior. And then like the behavior problems with the significant medical dimensions, I have taken like the learning disabilities. So learning disabilities, in addition to academic learning challenges, students with learning disabilities also experience social, emotional, behavioral difficulties. Young students with learning disabilities are at a greater risk for developing behavioral difficulties than their non-disabled peers. So, for the learning disabilities, successful integration of digital technologies into clinical decision-making pipelines and the advancement in automated decision-making using artificial intelligence algorithm highlights the importance of augmenting teaching and treatment with using novel algorithms and high fidelity sensors. And also like the learning deficits of students of LD are prevalent in the extant research, but the behavioral needs appear to receive less attention. And there are more articles that suppose that we can treat the learning disabilities with efficiency, which include which includes multi-component motivational intervention that consisted of explicit timing, immediate feedback through self-scoring, goal setting, and positive reinforcement. And we can even use a token economy approach like to increase the students' concentration on learning and facilitating the process in the classroom. So now we are in medical problems with significant behavioral dimensions, and I took diabetes. So whenever it comes for some medical problems, just don't listen to the diagnosis. Don't get scared of the diagnosis. We behavior analysts, we are going to deal with the behavior. So we have to concentrate more what behaviors the clients are exhibiting because of those medical conditions. So it's our duty to look into the behaviors and not into the diagnosis, so that we are confident on our own goals and on our programs. So for diabetes, like a child's attitude towards eating is a major determinant of his or her food consumption, and it is one of the important behaviors during the treatment of diabetes. Diabetes is not a diabetes in children is really a serious problem. So behavioral intervention delivery via internet mobile health technologies is an area of growth in diabetes. And then we are coming to the problem solving. Like we are also having some multimedia witness training in coping and problem solving skills and the social networking. Like we can use this for the adolescents because they are more into the technologies. And we are having some problem solving. Like problem solving is a learned skill with documented benefits on behavioral management of diabetes and health outcomes. Like teaching a simple method of identifying the problems, goal settings, and the brainstorming solutions, and implementing and evaluating a solution. And we can go beyond education, like consider the multiple components to behavior change recommendations. Something like optimal health outcomes for people with diabetes require implementation, execution, and maintenance of numerous and complicated health problems. And don't provide a one size fits all recommendation. Always offer a recommendation that considers the age, gender, ethnicity, community, infrastructure, and the behavioral and all the behaviors exhibited by the particular patient. The last domain we are going to discuss is the non-compliance. So, the non-compliance behavior frequently interferes with effectiveness of treatment for a variety of medical conditions and can have serious consequences. So, other than like what the non-compliances we are seeing in the classrooms and the other setups, there are some serious consequences that in the medical conditions also medical field also facing. So most clinicians have had little training in identifying and have a few tools to cope up with these type of behaviors. So there are few recommendations for non-compliance, like identifying the problem, like the problematic transition, and like select appropriate reasoning, transition support, implementation of supports, and collect data and problem solve for a useful successful transition. Like for example, we have to identify the problem, like so a few studies emphasize that if we are going to explain the exact disease condition and what we are expecting from the child to do, that will work for to some extent. So that is what they are saying, like identifying the problem, setting the reasoning, and something like that. And we are having various strategies including like minimizing wait time, teaching class wide transition rules, and providing warnings prior to transition were proved to be effective in the non-compliance in the school setting. So we can apply empirically validated intervention, including those incorporating high probability requests, visual activity schedules, and video modeling for those non-compliances in the medical settings. And we can have additional strategies implemented for individual children, including those focusing on antecedent prompt procedures, like we can have peer mediation, different reinforcement of other behavior and extinction, and then we can have some multi-component power land. Now, dimensions of ABA in behavioral pediatrics. So, when coming to behavioral dimension, like so for every clinical condition, the client is going to exhibit some behavior which we are going to operationally define, that everyone can take data on the thing. So it's going to be behavioral and technological, because for sure as a behavior analyst we are obligated to do everything in a technological way. So for these clinical conditions we are going to operational define, and we are going to have something like technological so that everyone can measure. And for the dimensions of applied and effective, I 100% I strongly agree, like when we are going to be in behavioral pediatrics we are going to consider the treatment of a children, the behavioral condition of a child, so that is going to be applied and effective, that is going to be socially significant. And for the analytic we are having more data and more literatures which provides more data, like the ABA interventions are having more effectiveness in treating the behavioral disorders of pediatric cases. So we are good with the analytic dimensions as well. And for conceptually systematic, however, if we are going to have some ABA interventions, we are going to be conceptually systematic. We are going to use more reinforcement and more antecedent strategies, something like that. And for generalization, so we are not going to have like one size fitting for all clients, but we can have the thing, like for example, say for example, if you are going to have some non-compliance in a different settings, we can generalize that. So we it's like for generalization it's like it depends on the so for generalization it depends on the settings and not on the disease conditions. So for separate disease conditions we are going to have separate interventions and separate plans, but for the same disease conditions we can generalize the settings. So when it comes to ethics, like we are going to abide all these codes, like 2.08 for every intervention we use understandable language, characteristic communication with the clients, parents, caregivers, and even the referral pediatricians, everyone, and we explain our procedures before implementing them, explaining assessment and intervention results when they are available. And according to 2.09, it's the parent or the stakeholders who are going to select goals, and we will design interventions including them, including all of them. And like for 2.10, it's like I strongly believe we are going to abide the code 2.10 when we are going to work with behavioral pediatrics, because we are going to collaborate with the like the parents, caregivers, pediatricians, everyone. It's like I strongly believe like when we are in the field of behavioral pediatrics, we are going to abide the code 2.10 like to 100% maximum. And according to 2.13 and 2.14, we are going to implement assessment, behavioral change interventions that are conceptually consistent with behavioral principles and that are based on scientific evidence. The best meet the diverse needs, contexts, and the resources of the clients and the stakeholders. And according to 2.15, we are going to select, design, and implement behavior change intervention with a focus on minimizing risk of harm to the client or stakeholders. However, it's obvious like it's our ethics, and we are going to do the same thing for a child, and it's like more ethical. And like according to 2.17 and 2.18, we are going to collect data and evaluate the data continuously to make database decisions. And according to 3.12, we are going to advocate for the appropriate services. Like if someone is making a referral to us, it means they need our ABA service. They consider our ABA services as an appropriate services, and we are going to advocate for that. Here are some resources like if you really want to do something with behavioral pediatrics, it's like just go through the Journal of Developmental and Behavioral Pediatrics. You will come to know all the new findings, all the new diseases, what are the behavioral problems, what are the medical problems with behaviors, and everything. Like the resources stated here will provide you information about how to diagnose the clinical conditions and how we can support parents. You can even find the hotline services, something like Talk It Out, so that we are going to support the parents as well. So uh, I talked to a few pediatricians, like I just want to get in some buy-in options, like how we can get into the behavioral pediatrics, because when I look for the materials, I can find more materials like ABA in the primary care, because everything is pushed into the primary care. But when I read about the developmental and behavioral pediatrics in the pediatrics, like we can do a lot in that area as well, but there is no idea about that field into for the behavior analyst. So I just talk to pediatricians and I make sure I want to understand their cloud, and a pediatrician has a cloud of referring their cases based on their needs. They usually have occupational therapists, speech therapists, and the psychologists in their team, as they don't have any knowledge about us. So it is our duty to make awareness about our principles to them. So like I have talked to few pediatricians, and 50% of them don't even have an idea about the ABA principles. So we can collaborate with the local pediatricians and create awareness about the ABA. So whatever the pediatrics is having a lot of different branches, as behavior analysts we can do something to them. Like see for example, those are the four domains which include all these types of pediatricians. So we can do something with those domains, and we are going to help the pediatrics in its entirety. Thank you. And here is my reference. Thank you so much, everyone.